The gastrointestinal side effects of pirfenidone really, is nausea and essentially an upset stomach and acid reflux are kind of the dominant symptoms periodically. Those symptoms become so severe that people vomit. Loss of appetite can accompany this medication, and diarrhea is unusual, but can happen. And again, getting people through these symptoms, initially at least, is all about that dose escalation strategy. So trying to manipulate the dose up and down to try to get, to try to allow people to build some tolerability before getting up to the target dose. Proton pump inhibitors such as omeprazole and H2 blockers, famotidine, ranitidine, can be helpful if upset stomach and reflux are some of the dominant symptoms. Pro-motility agents can be used to help with some of the nausea perhaps, and then anti-nausea medications can also be used. It's unusual that we go this far with trying to develop tolerance or tolerability of the medications, but something to consider. So nintedanib, it's all about the diarrhea, unfortunately. So up to 2/3 of patients who are started on this medication experience diarrhea. Less commonly nausea, vomiting, anorexia, or anorexia is a loss of appetite. So the diarrhea can be pretty effectively managed with loperamide or Imodium. And so that can be approached in a couple different ways. You can either use it as needed. So if a bout of diarrhea happens, you take some to prevent more from happening. And so you use it sort of on an as needed basis. And then I also have a handful of patients who just use it on a routine scheduled basis. So they'll either take it once a day or they'll take it twice a day to prevent diarrhea. And I have a handful of patients who have had some success with that type of approach and strategy.